As the core gets stronger, will that help with the pelvic tilt? Natasha, I don't know what pelvic tilt you've got, or you might have been told you have. Pelvis should technically be tilted, because what you notice is when we tilt the pelvis forward or backwards, we change the slope that the L5 is sitting on the sacral body. Really, this L5 S1 disc is actually a little bit wedge-shaped, because the sacrum should have a slope to it. So if we posteriorly tilt, we flatten that slope, squash down, increase pressure through the L5 S1 disc. If we have an anterior pelvic tilt, we create it too steep, and it creates a shear, which increases the strain on that L5 S1 disc. So we want to be just right. Looks like what Goldilocks was looking for with the three bears. It needs to be just right. And there's wiggle room with just right. And most of us as human beings with a spine have developed just right. That's the great thing about our bodies. Some of us do have a tilt. If you are a human being operating in the modern world, it's more likely that you've got a posterior tilt than an anterior pelvic tilt. But unfortunately, there is a proclivity to diagnose everybody with anterior pelvic tilt in physiotherapy and osteopathic and clinics with no evidence whatsoever other than a physical examination. A lot of clinical practitioners do not have the humbling experience of having to reevaluate the severe inaccuracy when it comes to lumbar spine alignment that physical exams have. They are not very accurate. And it's only when you've done thousands of these where you've got a patient coming in with lower back pain, being told they've got anterior pelvic tilt or this, that, the other, and then you look at them and you see, okay, well, maybe there's a bit of anterior pelvic, maybe I could get on board with that. And then you go and have an x-ray and you see the load-bearing mechanics of the spine, and then you go, and you measure it with numbers, not looks a bit too much or looks a bit too little. So often you'll see on radiology reports, an increased lordosis. How much? Did you just eyeball it? Did you measure it? What's the value? If you're going to say it's increased, is it increased within normal limits and therefore not worthy of mention, or is it increased in a significant manner or decreased? And so often, what you thought might have been there from the surface is actually not there. The biggest mistake of this, one of the biggest indicators, or two, are going to be the tummy position. So you get told something like this: oh, look, your bum sticks out, okay? I'm trying to stand on the white background. Oh, look, your bum sticks out, and oh, look, it's so deep here. And oh, look, your tummy's sticking out. You must have anterior pelvic tilt. And it's like, no, I'm just not engaging my core. Now I don't have anterior pelvic tilt. Now I don't have my tummy sticking out. My glutes are still there. Guess what? My spine, lumbar spine, my L5 is where my hand is. The glutes have nothing to do with that. If my L5 was here, right, then you could see that actually, yes, that would make sense. But they just are demonstrating by talking about your glutes in the presence of anterior pelvic tilt